Maria with us, who's going to have a microneedling treatment with the DermaPen. So the DermaPen is a microneedling device that is used to reduce acne scars, to reduce chickenpox scars, and it is a fantastic collagen stimulator to improve the complexion as a whole. Maria, I will just show you as well, there are little tiny needles here on the top of the gadget, and what happens with these needles is they rotate and they make microscopic little holes in the skin. What happens then is the body triggers an immune response, or a response like you would have to a cut or a scratch, and it sends out collagen repair cells, it sends out fibroblasts and what are called growth factors. So over a period of weeks, these will repair the skin, they'll improve the thickness and improve the texture of the skin, and they reduce fine lines and wrinkles, and they also reduce little acne marks or chickenpox marks. So it's a fantastic treatment. It's been around for a number of years. It has given very, very good success rates. For acne scarring, we tend to do 2 treatments about 8 weeks apart. And if we're doing it for a complexion, we can do 2 treatments about 6 weeks apart. So Maria, when you leave here, your skin will be a little bit pinker than usual. Tomorrow it might still be a little pink, and we'd recommend that you use a sunscreen over the coming weeks just as that repair process continues on. Have you any questions about it?
No.
So the treatment is really not painful at all. We use a numbing cream which helps to reduce the discomfort, and we're going to clean the face completely because we really want a clean base for this procedure. We're going to be making little tiny microscopic holes. They will close within about an hour, and you can cover it with makeup generally the following day. We like to keep your skin makeup free today if we can. We're going to use a vitamin and hyaluronic acid serum as well, which acts as a glide medium so that the machine won't stick on the surface of the skin. The other advantage, Maria, is when those little pores are open and we've got microscopic holes, is that serum will absorb many, many times faster than if we just applied it onto intact skin. So you'll get a nice benefit from that as well. So I'm going to just clean the skin with some antiseptic. We're always very careful with procedures on the face that we keep the skin really squeaky clean and reduce just the surface bacteria that we normally have on the skin, because we don't want those getting in when the skin is a little more vulnerable. The DermaPen treatment has been around for a number of years. We use a sterile needle for each person, and it doesn't hurt at all. Once the numbing cream is applied, it really is quite a comfortable procedure. So Maria, you have some fine lines across your forehead, and the DermaPen will help those as well. So I'm going to apply a vitamin and hyaluronic acid serum, and Maria, you'll just feel this a little bit cold on the skin. So the serum helps me just to glide across the skin, and what we're looking for with the DermaPen is we're looking for 2 out of 3 endpoints. These endpoints really show me that the treatment is working. And the 3 endpoints are redness, which is a sign of injury, so the body will respond with redness to any scratch or break in the surface. We're also looking for pinpoint bleeding, which is again a sign that we're getting in and getting down into the dermis where we want to stimulate those repair changes. And also we get a little bit of swelling, which is very subtle to see on the camera, but it may be visible. So we want those endpoints to make sure that we're actually causing a process to stimulate that repair. So the machine, Maria, is going to just vibrate a little bit. I'm going to start gently on your forehead. I'm leaving the numbing cream on the rest of your face so that by the time we work our way around, we've really got the full benefit of that numbing cream. If you find it's stingy or sore in any area, tell me and I'll just move on to another area. So the process with the pen is we're going very gently on the skin. Is that okay, Maria? And we are using the vibrating needles to make really tiny little holes in the skin. Shouldn't be painful at all, and you can see I'm not pressing it into the skin, I'm just gliding it across. There are very good studies now with the DermaPen showing that it's pretty much on a par in effectiveness with some of the laser machines which are used for rejuvenation. It's got a much lower downtime than laser machine, it's less discomfort, and the recovery is much quicker. So already, even with the light pressure, I'm getting a bit of redness, which is what I want to see. I'm following a grid pattern so that I ensure that I'm getting a nice distribution of the needles across the whole area, so that I'm not doing an erratic pattern. How does that feel on your skin, Maria? Okay, that's great. If I'm treating just general lines, for example on Maria's forehead, I will use the needle depth of about 1.5 or 1 millimetre. If I'm working on an area where there's some scarring, I will go deeper, which would be 1.5 millimetres, up to 2 millimetres, and then sometimes even 2.5 millimetres. Maria also has an old burn scar on her neck, and we're going to treat that as well in a few minutes. I find the Dermapen is excellent for scarring from burns even, and some people react abnormally to skin injury and form keloid, which is where the scar is hypertrophied or thickened, and it can be raised and red, and the Dermapen is a good treatment for that as well, but you do have to go deeper because the scar thickness is greater. So Maria, I'm almost finished now on your forehead. And when we're finished today, your skin will feel a little bit like it's been sunburnt. It's that same sensation of it being a bit tight and a bit red. And you can use wet face cloths in really cold water just to soothe it, or you can use an ice pack if you need to. So we'll just turn that off for a minute. Now, so I'm just going to clean the numbing cream away. This numbing cream is very effective because if you used the Dermapen without this numbing, it really does sting. And again, I want the skin really nice and clear. Where I'm using the Dermapen on the nose later, I'll just have it at probably 0.5 millimetre, and we go very gently around the eye area because the skin is thinner and it's again a little more vulnerable to changes, so I'll go very gently. So I'm just going to put some more serum on your cheek. This serum, as I mentioned, will get in really well into those little microscopic holes, and it'll give your skin a really nice boost to help stimulate the repair process. So I'll go gently around your eyes, but I do want to just get in as close as I can, and particularly to where the numbing cream has covered, because I want to just reduce those fine lines which tend to bother women as they get into their 30s. So we'll just turn that on again, and I'm just going to go a little more gently now on your eye area. So the process is the same, Maria, and you can keep your eye opened or closed, whichever you prefer. And I'm really just gliding very gently around the eye area. Is that okay? Yeah, great. Often the Dermapen is a good treatment for people who want some mild rejuvenation but really don't want to embark on a treatment like botulinum toxin injections or dermal fillers. And it's a good entry level treatment for people to try, where you'll get a nice subtle effect, but you won't have really much downtime, and you won't have a significant change in appearance because we're just really working on the skin itself. Does that feel okay? Mm-hmm. Great. So I'm just going to turn it up a little bit more, and I'm going to just work around the mouth area. Often as women get older, and men too as well, we form little vertical lines, and the Dermapen is very helpful at reducing those. We see them in smokers, but we also see them in people who don't smoke, and they're just caused by contractions of the orbicularis oris muscle around the mouth, and the little fibres tend to pull on the skin and create little vertical lines. So the Dermapen is a really good treatment for those. Again, you can use botulinum, or you can use filler if they're very established lines. So I'm just going to work a little bit on your cheek here as well, and each time I'm just varying the needle depth for the appropriate area that I'm working on. So it's not really an uncomfortable treatment. It takes probably up to 30 minutes just to work around the whole face. And we've got a nice response on the forehead, which is showing us that that's really going to work. Around the mouth it can be a little bit sensitive, but you don't seem to be having any discomfort with that. And again, I'm just working in a grid pattern to make sure I cover areas. If I find an area that's particularly got some scar tissue, like a really focal acne scar or a chickenpox scar, I do tend to turn up the dial and work a little bit heavier on it, and that area might be a little redder than the rest for a day or two. Over on your cheek here, Maria, you have again one of those endpoints we're looking for, which is miniature little specks of blood. And I don't clean your face till the end because I want that serum really getting in to your face through the whole procedure. So when we're finished, we'll clean the skin gently. Is that feeling okay? Great. So I'm just going to continue to clean the numbing cream off the rest of your face, and we'll work around. And then, as we mentioned, we're going to just do a little bit of work on the burn scar that you have as well. On the nose, the Dermapen is really great for reducing pore size. We again go really gently on the nose because it just tends to be a little more sensitive and it's got lots of nerve endings. So again, I'm just going to drop some serum on. And I'm just using a no-touch technique with the serum because I want to keep that product nice and clean as we're putting it onto skin that's a little more vulnerable. And I always recommend to people not to use old makeup that we all tend to have stashed away in our cupboards, which has been sitting there for a while. So really we want you using nice clean products or relatively new products within their expiry date over the next weeks while your skin is repairing. Does that feel okay on your nose? Yeah. Sometimes working on the nose makes people sneeze. It is that little sensitive, but you're doing very well, and we're more than halfway there. So people ask how many Dermapen treatments they should have. The average is probably 2. We do use more if we have somebody with very deep acne scarring or a deep burn scar, and it is useful for stretch marks, and in some situations we might do 3 or 4 treatments for stretch marks. It doesn't have any benefit for cellulite, but it really is good for stretch marks. Just going to work on the area now above the lip, and I'll turn the dial up a little because I want to get a bit deeper there, really as a preventive treatment for stimulating collagen and preventing those little vertical lines. The benefit of Dermapen will go on really many months after the treatment, so we're waiting about 2 weeks to see a benefit, and I can just see a little more scarring here, so I'll put some more serum on, and I will go a little bit heavier there. Are you okay there, Maria? Great. We don't use the Dermapen if somebody has a cold sore because we would be at high risk of spreading that cold sore, so we wait till somebody has cleared it. We don't treat active acne with very obvious spots because it doesn't do any great benefit. So the main benefit for acne is when the acne has subsided and you're really just treating the little residual marks that can be left. If people don't squeeze the spots, the scarring risk is less, but even with a good skin care, people with acne can still get scarring. So I do find this a really successful treatment. People ask how long the benefit will last for, and it really does go on for many months. So again, Maria, you won't be able to see it now, but you have a little bit of that pinpoint bleeding around your mouth. And that's again a good sign that this process is working well and is really getting into that dermis where I want it to work. Dermapen is a treatment that can be combined with other modalities as well. We wouldn't use it on the same day as a chemical peel because, again, you've lots of microscopic holes in the skin, would be too vulnerable to the effects of the peel. But once the skin is repaired, you could certainly put on a glycolic acid peel. You can use Botox again, we tend to leave a day or two, and you certainly can mix it with dermal fillers as well, but not on the same day. So I'm just going to turn it down again and work very gently, Maria, just around your eye area. And this can be a little bit tickly. The dermapen has never been shown to cause pigment or pigmentation disorders. So some people who have laser worry that they're going to get extra pigmentation or even areas of low pigmentation called hypopigmentation. But the dermapen has no such risks and can be used on any kind of skin type. So people with very fair skin right up to very dark-skinned individuals, and it doesn't have any risk of causing patchy pigmentation. So it's useful from that point of view. So we're virtually finished now. I will clean the skin, and then what we're going to do, Maria, is we'll move on to the chest area where you have a small burn. And you mentioned to me that burn is really quite old, and it was a result of a hot drink, and we should find that the dermapen helps that a lot. So I'm just going to wipe off the skin, and we're taking away any excess serum and also just clearing any little areas of blood staining. Today's quite a cloudy day, but we will still put on a sunscreen for you going home, and then over the next few days just make sure that you are wearing a sunscreen. Again, because of the stimulation that the dermapen does, sometimes the skin can be a little flaky or dry in about 3 days' time. So if you notice that, just keep it moisturized. And again, just make sure you're putting clean products on your skin over the next few days. So what I'm going to do, Maria, is we're just going to clean this area here. And I wonder if we could get a close-up of that scar tissue just to have a look before we do the treatment. So Maria, you have a burn scar here, which was when you were a child and you had a hot spill of drink on your chest. So we will use the dermapen to reduce the appearance of that scar as well. We've put on some numbing cream, and I'm going to just tuck in a paper towel here. So again, the dermapen, it is a collagen stimulator. The needles will physically help to break up the scar tissue a little bit, and you will find that the appearance of that scar significantly improves. For scar work, we would recommend another treatment in 8 weeks' time, and we'll see you back and then have a look and redo the treatment then. Okay. Great. So again, I've cleaned the skin with antiseptic because I'm going to be making little vertical injuries. I'm going to use a serum which will just help the machine to glide, and it is giving you some hyaluronic acid, which is a major component of our skin. And you'll find, again, the machine's going to vibrate. It can be a little bit tender, but we'll go very gently. So the same process as with the face and neck, and you can use this on the hands. I'm just going to glide very gently across the scar. So I'm getting a couple of benefits here. I'm physically, with the needles, getting in and breaking up some of those little fibrous bands that are pulling the scar tissue down and making the surface a little irregular. And I'm also stimulating that cascade of repair cells, fibroblasts and growth factors and collagen that will improve the appearance of the skin over many weeks. Some people will get a little bit of swelling straight away, and it's tempting to think that that's an immediate response from the dermapen. It's not, it's really just the injury, and any little bit of swelling subsides within 24 hours. So people ring me and say, oh, the fine lines are great, they've disappeared. They do come back, and then you're really waiting for the repair process over a number of weeks. You should see a benefit within 2 weeks, and then the full collagen cycle takes about 6 weeks to work. So how does that feel? Yeah, so again, we're getting the response we want, which is a little bit of redness. I can see a little bit of swelling, and we're also getting those tiny pinpoint marks of bleeding, which is a good sign. And this is all we need to do on a scar area, and then I'm going to move on to a little smaller scar that you have here on the side. So again, it'll be a little bit tender, Maria, or it can be. This works well on keloid scars as well. Keloid scars are raised, bumpy, tender scars where some people have a genetic tendency to scar abnormally, and we tend to be really cautious with keloid because we're afraid of doing anything to intervene that could worsen the keloid. So this is a procedure that's quite safe, and I'm happy to do it on keloid. Additionally, sometimes with scar tissue we can inject a very small amount of a steroid, which reduces the inflammation within the scar tissue and can add to the improvement in appearance. But your scar is fairly flat and it's very, very old, so I'm confident that the Dermapen alone should be enough. If somebody comes in with a very active, red, angry, raised, bumpy scar, I can use some steroids directly into the scar tissue to improve it. So we're virtually finished. I can feel the scar tissue is a little bumpy, although I'm gliding very gently. So you'll probably find that this area looks a little bit redder than your face did. And already, even as we're looking now, your face redness is settling down. So we're finished with those scar areas. I'm just going to clean the skin. And again, any procedure where you're breaking the skin, we really just have to be so clean and careful. And that's why these procedures should be done in a clinical setting. So what I'm going to do now, Maria, is just to put some sunscreen on your face, and then you're ready to go. You'll be a little bit red for a couple of hours. You can disguise it with makeup. We'd ideally prefer you not to wear makeup today, but tomorrow you could certainly put on makeup. So Maria, I'm going to put on just, this is a final layer of sunscreen. I've deliberately picked one with quite an oily texture because I want to just rehydrate your skin, and generally we would recommend a factor 30 for sun protection. And today when you go home it will be a bit tight, it'll feel a bit red, and just keep it soothed or keep it moisturized, and the discomfort wears off pretty quickly. Because I've gone a little more deeply on the scar areas, I'm going to protect these just with the dressing, and you can just leave this on for a couple of hours. And it's because we've got in and broken up that scar tissue that I just don't want that rubbing against your clothes and causing any discomfort. So Maria, thank you very much for coming in for the Dermapen treatment. We'll see you in about 8 weeks and reassess your skin, and it'll be really nice to hear from you and see what benefit it's had. And we will repeat the treatment for the scar area on your neck as well, and you should find that gives you a significant benefit. So Maria, thank you very much for coming in to have the Dermapen treatment. Your face will be a little bit tender and a little bit red this evening, but you can disguise it tomorrow with makeup. If you have any questions, don't hesitate to ring me. Your chest area will be a little tender where we've gone deeper in the scarring, and I've protected it with the dressing for a few hours just to stop it rubbing against your clothes. So I hope you enjoyed watching the demonstration of the Dermapen. Today we used it really for two purposes. One was for fine lines and wrinkles and general little acne marks and a general collagen stimulation on the face. And the second benefit was where we used it on Maria's old burn scars, which will significantly reduce the appearance of those and make them much less noticeable.